Now, the National Health Services Laboratory says the Covid-19 backlog has been reduced to 63,000 unprocessed specimens. Now, presenting to Parliament yesterday, the NHLS CEO, Dr. Kamy Chetty, defined the backlog as specimens which are older than 3 days from when they were first registered at the laboratory. For more on this, I'm joined by Laura Lopez Gonzalez from the Bhekisisa Centre for Health Journalism. A very good afternoon to you, Laura. Now, you as a Bhekisisa have literally been on top of this for quite a while, and it seems like you are having a bit of difficulty in finding out the exact extent of the backlog. Now that we know that it is over 63,000, your reaction to that, is it more or less than what you had anticipated?
Right. So thanks so much for having us. It's definitely come down. So at the end of May, we were looking at a backlog of about 100,000 tests. So definitely progress there, and we can see that the National Health Laboratory Services has really scaled up testing. We're doing anywhere from about 20 to 40,000 tests a day, according to the latest data. So you can see steps there, but again, that backlog is quite considerable and very concerning.
Do you have an idea of the number of national health laboratories that we have nationwide, as well as the additional measures that have been put in place to ensure that this backlog is reduced?
Sure. So there are several hundred NHLS laboratories around the country, and I think it's important to note that not all of this testing is necessarily taking place there. So we have about 60 mobile units, and those are vans equipped with laboratory sort of technology in them. And then what you're starting to see provinces do in the Western Cape and in KZN is to start bringing our academic laboratories in on this to help run some of the samples, and also we're starting to see more involvement from the private sector in certain kind of cities that are having a real emergency in testing in terms of places like Port Elizabeth. So definitely movements there to try to deal with the backlog, and also some reprioritization within that backlog. So I think what you're starting to see now is a kind of a sort of coming to terms with the fact that this sort of shortage of testing materials that's happening globally is going to be with us for the long haul. And how do we make use of the resources we do have in the best way possible?
Do we have an estimation of how much time it's going to take, or how the time span is going to be reduced due to the partnerships that you've mentioned with academic laboratories as well as private institutions? How is that measure of margin going to be reduced now?
I think it's really difficult to say at this point. So the prospect of bringing academic laboratories on board was really something that was kind of mooted months ago, and you're just starting to see progress really happening there. So in KZN, we think that they're going to be online in the next week or two, and the Western Cape is a little bit farther behind. And then what you also see is provinces start to sort of take measures to sort of prioritize who gets testing. Obviously, the Western Cape is the first province to do so. But you're also seeing the NHLS within its own sort of body start trying to color code samples to see who goes first to the testing queue for processing and who can wait a little bit longer.
There are some implications, obviously, to the delay of getting the results. Won't you take us through those? I mean, there are some people who are waiting now 10 days in order to find out whether or not they are COVID-19 positive, and in that time span, life for them continues as usual.
Right. So we talked to, for instance, doctors in the Western Cape. They had been waiting to deliver results to patients for like 11 days, 14 days. And so one doctor recounted having to tell a patient who was a taxi driver, listen, your results have come back positive. And obviously that person is then filled with a lot of anxiety. I've gone back to work. I've exposed my family. We hear about health workers themselves waiting quite a long time for results, and obviously that's a concern because we know both from St. Augustine's in Durban and also cases around the world that our hospitals can turn into hotspots. So really it causes a lot of anxiety, and some clinicians also fear that it sort of reduces the buy-in to the community screening programs.
And obviously, people were told to wait about 2 days or so in order to get their results. I mean, if you go to a private lab, you wait 24 hours in order to get the results. But you also interviewed a woman, a health worker, who was talking about the sheer embarrassment of having to call somebody and tell them that actually you are COVID-19 positive. Tell us about that particular incident.
Right. So we spoke to doctors in the Western Cape, and they were obviously, this was a couple of weeks ago, but they were obviously very anxious about this delay. They felt a little bit powerless about trying to speed things up for their patients, and also very embarrassed to have to call them back and say, listen, the results have come back positive. Again, a lot of anxiety, a lot of fear, and everyone kind of has the same fear attached with this, right? Like your first instinct is, who in my family have I put at risk, and what measures could I have taken if I had known sooner? So I think that moves to sort of reprioritize and kind of really sort of make use of what we do have are going to be welcomed.
And there were also some challenges regarding the testing kits. Tell us about those.
Right. So these are not unique to South Africa. The world is sort of all scrambling for the same sort of testing kits, the same sort of chemicals we need to do the testing kits. So what you're starting to see is the African Union, for example, is trying to pull the buying power of countries on the continent to better sort of position itself to get a hold of these resources. What you're seeing the National Health Laboratory Service do is to try to expand the kind of different types of testing machines it uses. And when you expand the pool of the machines that you're using, you can start dealing with more manufacturers, and you can start being less reliant on sort of a few. So hopefully that also helps shore up supplies of testing kits.
And how assured can we be about the credibility of the outcomes that come from these samples?
So I think it's important to know that before any test comes into South Africa and is widely used in the public sector, it goes through very rigorous testing care of a body we call SAPRA. So SAPRA has gotten, I think, several hundred applications for new testing kits and new types of tests. And they're busy sort of evaluating those, including some rapid tests that would be somewhat useful in diagnosing COVID-19. And the other kind of concern is, though, that the longer that samples are sitting in the NHLS queue to be tested, the higher the risk of false positives. So I think, again, you're seeing that reprioritization of samples to get them through the queue as quickly as possible. But infectious diseases specialists have said that, when push comes to shove, if you want to look at reducing the backlog, you might want to consider ditching samples that are more than 48 hours old. So again, that would be the bulk of the backlog, but that's not a recommendation we've seen taken up yet.
You mentioned that the longer the samples stay, that increases the likelihood of a false positive. I mean, I'm no virologist or laboratory health expert, but my assumption would be it would perhaps increase the likelihood of a false negative. Because, for example, is the sample then preserved during that particular time? And obviously the virus is still active even in that sample before it actually gets tested.
Yeah, so I think it's important to know that when you get a positive result, that's confirmed by several tests. So people shouldn't be fearful that the results they got are wrong. But it is something that infectious diseases sort of specialists have sort of said, should we start rethinking how long we leave samples in the queue. But I think the important thing for people to sort of take away without getting into like the nitty-gritty of things is that you've got confirmatory tests going for the results you're getting, so you shouldn't necessarily panic about your results being incorrect.
All right, well, thank you so much for that, Laura, for that update. We have had a confirmation from the National Health Laboratory Services that the backlog is now sitting at just over 63,000. They are, reaching out to private as well as academic health institutions to assist with the backlog. And I guess it is a concern with many people going back to work and maybe they've had their test but don't still know the status of their results.